It's the #1 mineral deficiency in the world. Over 1.2 billion people affected. We need to talk about iron deficiency today. These are the 10 signs and symptoms of iron deficiency that your body is trying to warn you about. But first, you need to know why iron is essential for your body and what tests you actually need to figure out if you are iron deficient. Iron is really important in getting oxygen throughout your body. You want to get that warm oxygenated blood going everywhere to your brain, everywhere that your body needs it, right? And iron is involved in that transport. Most iron is actually found in our red blood cells in hemoglobin, which is a protein that's involved in oxygen transport. So it helps carry oxygen from our lungs, the warm oxygenated blood, all throughout our body. It's basically like an Uber for your oxygen. It picks it up and comes and delivers it to wherever it needs to go, where your body needs it. It's also involved in a lot of reactions throughout your body. It's involved in energy production so that we can make ATP, which our cells need to have energy. And iron is also important in our immune system. So if you're iron deficient, it can predispose you to having a weaker immune system. Okay, so there's a lot of different causes and risk factors for iron deficiency. Some of them can be your diet and lifestyle. So if you have a very restrictive diet or a diet that's really low in iron, so not a lot of red meat or spinach, those are things that are high in iron. If you're not eating a lot of iron, then you're likely going to be deficient in it. And certain medical conditions, specifically ones of the digestive system and chronic diseases, can contribute to iron deficiency. You might be deficient in iron if you're not absorbing a lot of it through your diet, or if you have a medical condition that prevents absorption, or if you're losing a lot of it. So this is why iron deficiency is more common in women, because women, especially women that are menstruating, are losing blood, especially if you have heavy cycles, you are even more at risk. And in fact, about 30% of women are iron deficient. We also need to talk about iron deficiency versus iron deficiency anemia. You may have heard both of these terms. Iron deficiency is just like the name suggests, right? So you're deficient in iron. You're not getting enough of it, whether that's through your diet or you're not absorbing it or you're losing a lot of it. And iron deficiency anemia is basically like a progressed, worsened form of iron deficiency. If you have untreated iron deficiency, it can now start affecting the production of your red blood cells. So you make fewer and less effective red blood cells. So you become anemic, meaning you won't have adequate numbers of red blood cells being produced and they won't be of the same quality. You need to know about testing for iron deficiency anemia really quickly, because testing for iron deficiency is kind of tricky because actually iron in your body is in different forms. It's in your blood in a certain form and in storage in a certain form. And also it can actually be affected by a lot of different things. Even being sick or having inflammation in the body can affect iron levels, or at least how we measure them on tests. You need to make sure you're getting the right and most reliable test. You will definitely want to get a CBC. So that's a blood cell count, including red blood cells. It will tell you how your red blood cells are. And you'll also get an MCV, which is basically looking at the size and quality of red blood cells. And typically in iron deficiency anemia, you will have a lower MCV because your red blood cells aren't as good quality, they're smaller and they're paler. You also want to specifically test for iron. Now, one of the most reliable tests for iron is ferritin. Ferritin is actually a protein that stores iron, but the reason it's great to test for ferritin rather than serum iron is because it helps us understand more like the long-term storage of iron, the actual reserves of iron that you have, whereas serum iron can fluctuate throughout the day based on what you consume. It fluctuates a lot, so it's not a very accurate or reliable test. So serum iron, it could help us understand things, but it's not the one I would recommend for reliable testing. Ferritin is a better bet. Now, you need to know also that ferritin can be affected by inflammation, for example. Different things can make it seem higher or lower. If you have inflammation, like if you've just gone through a sickness, you've had a cold, it can raise your ferritin temporarily and make it seem like you don't have low iron. Okay, let's talk about the 10 signs of iron deficiency that your body is trying to tell you. So #1, fatigue and weakness. This is a hallmark of iron deficiency or iron deficiency anemia, right? So we need iron to help with oxygen delivery to our organs throughout our body. If we don't have oxygen in our body, if it's not getting to the places it needs to go, we're going to feel tired because our body needs oxygen to survive and to have energy. And also, I mentioned iron is involved in energy production, getting usable energy for our cells, ATP. But if you don't have iron that's needed for those reactions to make ATP and to use it, so you're not going to have as much usable energy for your cells. And when your cells don't have energy, you don't have energy. It's fairly easy to get your blood tested for iron deficiency anemia. Just talk with your doctor about it, especially if you are a woman or you have heavy menstrual cycles. I would definitely suggest keeping that on your radar. Number 2, pale skin or cracked and dried mucous membranes. Now, mucous membranes are things like your lips, your eyes. Hemoglobin is one of the things that gives our blood its red color. Now, when you don't have a lot of iron or hemoglobin, your blood is not going to be as red, and so you're not going to have as much color. You know why we blush, right? We get blood going to that area. That blood going to our face makes our cheeks rosy. But if you don't have enough of that red in your blood because you're low in iron, you'll end up looking pale. You might also get cracked lips, especially in the corners of your lips, or really dry nasal passages. So like your nose will be dry, your eyes will feel dry, cracked skin even. So just like your mucous membranes will feel dry, cracked, irritated. You can even experience mouth ulcers and a sore tongue as a result. Number 3, brittle or abnormal nails. Low iron disrupts the production of keratin, which is important in our nails as well as our hair. You may have heard of keratin as a protein that's important in strengthening your hair, strengthening your nails. Now, if you're low in iron, you're not going to have as much of this keratin, so you're going to likely get more brittle nails. Your nails can also develop these ridges or what's called spooning. This concave spoon-like shape to your nail that's characteristic of iron deficiency. So the edges of the nail can be raised and the center is kind of depressed. If you're having these nail changes, brittle nails or these spoon-like nails or just abnormal ridges, it could be a sign. Number 4, continuing on with keratin, is hair loss. So if you have iron deficiency, you can lose a lot of hair, like patches of hair, or it can become brittle and dry. Again, that's related to lack of keratin production, which keratin is also involved in making your hair strong. But also because you don't have a lot of hemoglobin and oxygen going to the right places, including the cells that are needed to stimulate hair growth. You might see your hair falling out, or it just might not grow past a certain length because it's like, I'm done, I don't have the iron I need. Number 5, rapid heart rate and shortness of breath. This can be a significant one and can almost make you feel uneasy. So because you're not getting adequate oxygen to the tissues in your body that need it, including the heart, well, your body then tries to compensate by increasing your heart rate because it basically thinks like, if I increase the heart rate, that will make my body deliver more oxygen to that area. Also, you might experience shortness of breath because you're not getting adequate oxygen to the areas you need it. So you're struggling to breathe. This can really affect your quality of life. You might feel winded going upstairs when you're doing even mild exercise. Number 6, restless leg syndrome or RLS. Now, this is when you have this uncontrollable urge to move your legs. It can be this really unpleasant feeling like ants crawling, tingling pins and needles in the leg. Iron deficiency can contribute to this. Now, we don't know exactly why, but there's some thought that it's involved with dopamine because iron is involved in dopamine regulation. Now, you may have heard of dopamine as the feel-good neurotransmitter in your brain, affects mood, anxiety, and that is true, but actually also dopamine is involved in motor function. Low iron can disrupt normal dopamine regulation, which could potentially contribute to developing restless leg syndrome. Number 7, difficulty concentrating. This is a pretty obvious one in that if you're not getting the adequate oxygen your brain needs, you're going to have difficulty thinking, difficulty with memory. You might just feel like really foggy. And on top of that, fatigue doesn't help that situation. Number 8, along the same lines, increased headaches and dizziness. It's not exactly clear why you might get more headaches if you have iron deficiency, but it could be because you're not getting enough oxygen to the brain. That can trigger headaches. And of course, dizziness, because if you're not getting oxygen to your brain, you can feel dizzy and even faint. Number 9, a pretty common one that a lot of people can experience is cold hands and feet. You're not getting enough oxygen and enough circulation to your extremities, especially your hands and your feet. So you want to get warm, oxygenated blood to those areas. If you don't, they end up feeling cold. You might feel cold in general, but specifically you might notice it in your hands and feet. And finally, number 10, pica cravings. You may have heard of pica. It's actually an eating disorder where people crave unusual things that are normally things we should not be eating. So they crave non-food items like dirt, ice, clay. And it can happen as a result of other things, but iron deficiency is one of the things that can predispose expose you to that. Again, it's not really clear why this happened, but it's thought that because you have these nutritional deficiencies as a result of iron deficiency, it's like your body's way of compensating, so it doesn't have the proper nutrients it needs, so it starts craving unusual things. You can have cognitive effects, right, from iron deficiency. So it can impair your brain health and your brain function. If you have impaired brain health and just an imbalance in the neurotransmitters in your brain, it can make you have poor decision making, poor impulse control, and that can contribute to unusual cravings. It's also thought that iron deficiency can affect your perception of taste and sensation. So your sensory experience changes, so that might affect you craving unusual things that you normally might be disgusted by. Okay, so those are the 10 signs and symptoms of iron deficiency that you need to know about. Make sure those are on your radar so you either get tested or talk to your doctor about it, so you can either start supplementing with iron or incorporating iron-rich foods. I hope you found this video helpful. Make sure to give it a like if you found it helpful and you enjoyed it. And don't forget to subscribe so that you can become the healthiest and best version of yourself. Let's do it together.